Any instance of violence involving a child must be discussed with pediatric specialists. Do not discharge these patients. Before DC cardioversion of a patient with unstable tachyarrhythmia, press the sync button. After delivering the shock, immediately check the pulse. In a CPR scenario, you must immediately resume chest compressions without checking for pulse after shocking. Don't confuse CPR shocks with those given to patients with unstable tachyarrhythmia, in which case the pulse must be checked immediately after delivering every shock. In a CPR scenario, the shocks are delivered asynchronously. After the third shock, administer 300 milligrams of amiodarone. After the fifth shock, you can administer another 150 milligrams. When DC cardioverting an unstable tachyarrhythmic patient, once you deliver the third shock, you should administer 300 milligrams of amiodarone in 10 to 20 minutes before shocking for the fourth time. After the fourth shock, start a 24-hour infusion of the same. Nebulized salbutamol is the quickest measure in treating hyperkalemic patients. Sodium bicarbonate may also have a role for those who are severely acidotic. ECGs, cardiac enzymes, lying and standing blood pressure measurements, blood gas analysis, chest X-ray, brain CT, or other CT scans, and urinalysis may all have a role in the workup of collapsed patients or those suspected of having had a seizure. A child who has fallen off his bike and is brought to you crying with a fractured limb has a distracting injury by definition. Take extra care assessing their C-spine. Patients with infectious mononucleosis may develop a rash if they are given antibiotics. Patients with myasthenia gravis, on the other hand, may develop respiratory failure if they are given the wrong antibiotics. Frail patients may suffer catastrophic injuries even as a result of a fall from standing, have a low threshold for requesting a full-body CT, especially for those who are anticoagulated. Do not hesitate to declare a pediatric trauma call when you're concerned about the mechanism of injury. You can always de-escalate.